So for that study, although it looked at various different subsets, obviously the diffuse large B-cell lymphoma subset has been the one that's been publicized more and more mature. So at this point, I mean, they're still following long-term data. What we're waiting to really see is if the treatment regimen, which is Epcoritamab, will actually get an indication for patients with diffuse large B-cell lymphoma. So that'll be something that we'll see hopefully in the next couple of months. But if that regimen were to get an indication of diffuse large B-cell lymphoma, that would provide another option for patients, especially those who are unable to get to sort of CAR T treatment centers or who decline to actually be treated with CAR T, to have a sort of a similar off-the-shelf sort of treatment to hopefully sort of indicate sort of to improve their outcomes. So if we were to look at some of the data that was presented already, it does appear that the best outcomes we would see in that patient population are those who were CAR T naive, and we saw diminished responses in those who were prior exposure to CAR T. Some of that may be selection bias, at least for the patients exposed to CAR T, because ideally those patients we know have failed CAR T likely have more aggressive disease and may not necessarily be very responsive to T-cell directed therapy. Whereas the results that we see in the CAR T naive patient population, albeit are not identical, but are similar to what we see with responses to CAR T. Again, the downside to EPCO in that situation being that it's an indefinite therapy. So that is something that will need to be adjusted moving forward. Whether we can see we can stop some of these patients from having to continue to receive the injection, even though in the end it's once a month, that's still an injection they have to receive.